Hi, this is Pam McDonald, your host for Banter and Beans. It's a new show that Ben Kinsley and I are doing, and Ben's joining me tonight as co host. Hello, Ben. How are you?
Good. How are you?
Good, thank you. It's like we never talk to each other except on this thing. And what we decided to do, because the legislature is not in session, is to put Vote for Vermont on hold until next fall. And what we wanted to bring to you this summer are kind of what's brewing in Vermont. And we thought we'd start with the bills that were passed this year while you're home drinking coffee. They were busy passing bills, and we think there are quite a few of them that you should know about. So stay tuned as we let you know what's brewing in Vermont. I'm going to do Act 45, which is bill number H171. It has to do with the childcare system. And Ben's going to do a summary of H430 that has to do with Dr. Dynasaur. So here we go. We're going to jump right in and start. Ben's going to lead us off with Dr. Dynasaur, and then I'll kick in with Act 4. Go ahead, Ben. Take it away.
Yeah, it's an interesting bill. It's only 4 pages, which seems short to me. With most of the bills that I follow are like 25 or 30 pages. But basically, what this bill does is it expands Dr. Dynasaur. And for anyone that doesn't know, Dr. Dynasaur is a Medicaid funded program that is pretty unique to Vermont. Vermont has a Medicaid global commitment waiver, which allows us to spend Medicaid dollars more flexibly than most states. In federal Medicaid dollars are appropriated by the federal government, but they're administered by states. And this global commitment waiver allows us to kind of flexibly spend some of that money on things that weren't necessarily earmarked for Medicaid, as long as we meet certain thresholds. So Dr. Dynasaur is one of those programs that falls under global commitment, and it's meant for healthcare for kids, particularly low and middle income kids are what it was meant to help, but it's universal, so it's anyone can get access to it, and it provides healthcare for those kids, everything from your routine exams to things like glasses and other types of medical care for children. So this is a very popular program. It's often accessed through our school systems. They can help set up kids with appointments at doctor's offices and all sorts of things. So this is a widely available program, a widely utilized program. And what this bill does is it expands Dr. Dynasaur to allow for people who were previously ineligible because of immigration status. So say that someone who just came here, they're an immigrant from somewhere overseas or a neighboring country, and they just moved here, so they don't have immigration status yet. That normally would not qualify them for Medicaid because they need to be a citizen in order to access Medicaid. In Vermont, because we have this global commitment waiver, we have some flexibility around that. So this bill expands Dr. Dynasaur so that it is accessible by both children, income eligible children who normally would not have access because of their immigration status, and it also expands it to women who are pregnant who may have a challenged immigration status as well. So this is something that is normally covered under Dr. Dynasaur. It's kids as well as prenatal care, so it covers mothers who are expecting for those types of prenatal care, types of procedures or checkups, appointments, that type of thing. So so this basically expands it. One of the reasons for this, some parts of the state like Burlington, Winooski have a pretty large immigrant population, and specifically refugee population. So refugees will oftentimes take longer to process through immigration programs. So this allows them to get access to this particular program, which is very, very vital for prenatal care and for early childhood development. So,
Dr. Dynasaur was put in when Dr. Dean was our governor. And then you mentioned global commitment, but that came a little later with Mike Smith, right? And a different administration. So was Dr. Dynasaur in place, and then they were able to use the global commitment to support it better? Or how, do you have any idea how that worked from a timing perspective?
yeah, so originally Dr. Dynasaur was the mechanism by which we delivered the child programs through Medicaid. So Medicaid has programs that are dedicated to childhood development and getting access for low-income children. Dr. Dynasaur originally was the mechanism to do that, the program to do that at the state level. And since Global Commitment came along in the mid to late 2000s, that program has been expanded a couple times, and then we're able to now do things like this with it, where people that wouldn't normally be eligible for Medicaid can now qualify.
That's right. Well, this program has gotten national attention. This was a first for Vermont, and it was well received for sure. I'm very supportive of what this bill does, because we're talking about kids and prenatal. So
yeah, this is one of the most
their status. Yep.
This is one of the most popular programs that the Agency of Human Services runs, to be honest. Like, this is very, very popular program. It's well run. It's a well run program, and the overhead cost for it is very low. Very few complaints about this particular program, aside from some of the things that people may wish it would cover that are just constrained because of Medicare or whatnot. But
well, there's so many statistics about the if the child's health is good, and he or she is being well cared for, that their development and just going off into the future is just exponentially improved, because they have a good basis of healthcare. So it's money well spent for sure.
Yeah, it's one of those things that we talk a lot about schools and the performance of our school system. One of the things that we forget about is all of the things upstream from that, right? It's all the things outside of the classroom, because you can get a kid in a classroom, you can teach them, you can give them a great lecture, you can give them all the materials, but if they if they have a toothache, or they have a hearing problem, or they can't see the whiteboard because they need glasses, it almost doesn't matter. It doesn't matter if you have the best teacher, the best classroom, the best materials, the best curriculum. It doesn't matter, because they can't learn. They're not set up to learn. And that's true too of one of the things that Campaign for Vermont has talked about a lot is the wraparound services that we need in school systems, because if a kid goes home at night and their parents are either unwilling or unable to help them with homework, or he goes home at night, a kid goes home at night and their parents are screaming at each other and they can't think about doing homework, that's a problem, and that impedes their ability to learn in the classroom. So, when you talk about schools, it's not just what happens in the classroom that's important.
Yeah, you didn't mention dental. I'm assuming dental is included in this as well.
I believe so. Yeah, I'm not an expert.
Yeah, I would think so, because
I believe it is.
Yeah, because the teeth are very important. So that's great. I'm glad that passed and Governor Scott signed it, and it's a law.
It's in law.
So it's the law. So that was H430, and it's under Act what then?
That is Act 48.
Okay, cool.
Yep. And dental is covered. I just was
okay, cool. Thank you.
Covers...
Yeah, because that is, if your teeth are that just affects your whole body, because it drains into your system, and you're not feeling so good with a toothache and stuff.
And actually,
that's a great program.
It covers a couple of things actually that might be surprising. Hearing aids,
Oh,
dentures, eye exams, diapers, chiropractic services, a whole bunch of different things, nutrition
wow.
therapy, a whole bunch of things.
That's great. I'm very supportive of this, and if there are kids here who are not being helped, we should help them. This is one thing I don't have any problem with. Sure the kids are healthy. That's
Absolutely.
cool. Okay, so speaking of kids, I was going to talk about Act 45, which was H171 as it was passing through the House and Senate, and it has many primary supporters: Representative Marcotte, James, Kornhauser, Townsend, Wood, Yakavone, and Brumstead. And the purpose is to make sure everybody has affordable access to high quality childcare and early education, which I am very supportive of. Uh, I was one of the very few people in my party that signed on to the pre-K education, early ed, because I just think the sooner you get to kids and the sooner you get their minds working, they learn better, and it's much easier for them as they're going through the grades.
Well, research
Yeah.
definitely backs that up. There's no doubt. Like the research really does show that kids perform better long term if they have access to pre-K. There are some caveats to that, but by and large, that is the case.
Yeah, no, I think it's great. I didn't have any problem signing off on it. And this bill and the language now has copays in it, and I'm very supportive of copays because if you can afford it, you should contribute something to it. So what they wanted to do was invest heavily in childcare, and they wanted to kind of keep building on their 5-year redesign of the childcare financial assistance program, which was implemented in 2020. And that was based on a sliding scale. This bill's version actually uses an income eligibility scale that's based on current federal poverty levels, and it's adjusted for size of the family. And the co-payments are based on the whole family, not on dad or mom. It's the whole family, how many kids they have, and they're looked as a unit, not just individuals within that unit. And they have a lot of requirements of when you should do co-pays or when you don't have to. If your annual gross income is up to or including 150% of federal poverty guidelines, you don't have to have a co-pay. If your income is 350% of current federal poverty guidelines, then you have to pay. But the scale is encouraged to get you employed. They want you to be able to afford it, and they want you to start and be part of the economy of the state. They also have the ability in this bill to pay directly to and they use what they call the Vermont Child Care Market Rate Survey. So they pay providers equal to what other providers are getting, and there's a cap on that payment. And they also have in 2023, they're going to start upping the limit of the fee scale for each year. And they'll be increasing the amount that the provider and or the individual family member they get, as long as the co-pays will not exceed 10% of family annual gross income. I really think they've done this very well. As I was reading the requirements of how much you should pay and who does and who doesn't, I think they really thought this out very well. They also talked about in this bill the Building Bright Futures, which I was glad to see is still here and going strong. That's a good program. And they want to have the funds that have been allocated to Bright Futures to modernize their information system. And they want at least the first module done by October of 21 so that they can have some really good information on the children who are participating in our programs, and we know which areas perhaps need more attention than others with regard to the number of kids. And they have a group put together of stakeholders to make sure that this program is modernized, and they're counting on these stakeholders to present to the Bright Futures folks what they have to do with the system. And as soon as everything is functional, this is a good thing. The end user group goes away, which I think is a thing. They should have more of those where the committees go away after they've presumably done their thing. They also included scholarships for current early childhood providers, those who already have a business up and running. And there's a scholarship available for them as long as they're using their work to acquire credits for early childhood development. So they're really encouraging people in the business to go to school and to get their degrees in early childhood development, which I think is great. And they also have scholarships for prospective new people in the business. And they want them to be going after a college degree. The only downside is there's a lot of requirements. It's 38 hours a week, I think, that you have to 30 hours, sorry, that you have to commit to going to school. If you don't, and you have to work a year afterwards in the business, if you don't, you have to pay it back. And you get about $4,000 annually, which is a pretty nice sum. And there isn't any requirement on the people starting out. They actually may pay up to the full cost of tuition, which is sounds like a good deal. They also have money from ARP, American, what is that, Ben? American, what is ARP stand for?
American Recovery and Restoration Act.
Yeah, right, thank you. They have block grants and stabilization grants for high quality infant care, and they also put in this section information about BIPOC to try to encourage those people to get involved in providing daycare, healthcare, or to have their children, so that the child care services are culturally and racially diverse, to have a real family inclusive environment, which is certainly a good thing to do. And they also allow now there's no funding for this. I'm hoping it's in the big bill, the appropriations bill, but the Building Bright Futures people are being asked to hire a consultant who knows how to deal with kids from birth to 5 years, to come up with a plan on how to get data-driven accountability through data, and also to ensure that it's an anti-racist approach to daycare so that all children are inclusive. My problem was there was no dollars in this bill, and I'm hoping that there is money in appropriations, which is what happens a lot of times with these bills. They're asking for money, but it doesn't show up until it's in the big bill. And they want to make sure that a family doesn't spend any more than 10% of their annual income. And there's two models that they could choose to follow, these consultants. It's the cost of care model versus the market rate model. And it's a I thought it was a very good bill when I read it. I was excited to see that daycare is getting such attention, because it's really needed in this state for people to go back to work, and you always want to make sure your kids are well cared for. And so we need high quality daycare in Vermont. That's it.
This is one of those things too that there's, aside from the education benefits of having preschool and pre-K, because these aren't just necessarily daycare, although yes, that's a piece, that's a function of it. So there's educational benefits, but also there are economic benefits, because families can go back to work. You can't, if you don't have a childcare or reliable childcare option 5 days a week, then it's really difficult to work. Even in this work from home environment, it's difficult to get work done if you have a toddler that you have to chase around while you're on Zoom calls. That doesn't work so well. So even though this whole the work from home thing, and research indicates that 30%, up to 30% of people are still going to be working from home at the end of this year, at the end of 2021. So and that may continue in perpetuity. We don't know. That may just be a permanent thing. So with that in mind, yes, that creates some more flexibility, but we still have a shortage of childcare in Vermont. And one of the things that we highlighted in a report a couple of years ago was looking at the easiest thing we can do from a workforce participation standpoint is to get people who are already here back into the workforce, right? You can do this. There's this program from the governor that got a lot of attention over the last few years where we're trying to recruit people to come to Vermont to work remotely, bring your jobs with you. Last year, the big push was to provide stipends for people who are relocating for Vermont employers. So not necessarily just bringing their jobs with them, but coming to Vermont to take a job with a Vermont business. And that's great, but it's way easier to get someone who's already here to participate in the workforce, whether that is someone who is unable to participate because they're taking care of children, they're providing daycare because of their own children, or because they're retired or semi-retired. There's this new concept a couple of years ago that came out of where retirees are taking up internships to learn new skills. So someone who is a carpenter, let's say, is now going back to school to learn how to do medical billing, for example, something that is less taxing, that they could still do 20 hours a week, but is not less physically demanding. So, there's this movement where we can get some of these folks back into the workforce, whether because they're providing childcare to their own kids, and this gives them the ability to not have to do that, and they can re-engage with the workforce. So there's a lot of these sorts of opportunities. It's not just about childcare. It's not just about education. It's about a whole range of things. And it's monumentally expensive. I have a lot of friends that are that have young kids, and it's like having a college payment.
Oh, it's a killer. When I first came up here, believe it or not, I actually wanted to look into opening a daycare, and I was shocked at the cost of daycare compared to the Vermont salaries. In New York, if we pay that money, people make more money on similar jobs. They just do. They make more money in New York. And I was shocked at what people are paying for a daycare center, because especially for women, if I may make this a woman's issue, if you stay home with your child for however many years, you've lost that opportunity to build your career and to place and to bring more money into the family, and enter work after being home 5-6 years. You're starting from a difficult place. You're probably older than most of the people you're working with that are your peers, and it's just more difficult. So I was married, and Stacy went to daycare, and it was an amazing day. So much stuff. She just, by the time she got to kindergarten, as a matter of fact, she was sort of bored. And the teacher called me up because she was kind of creating a little problem. I said, she's done all this stuff. She's done it in preschool. Keep her busy, get her to faster if it's something that also includes education. It's great. I think it's wonderful. And I don't think I would have accomplished half the stuff I had accomplished if I had waited all those years to get back into the house, my little woman's thing.
We want to make sure that this is available to people so that
Right.
families don't have to choose. Do one of the parents have to put their career on hold for a couple of
Exactly.
years? And fortunately, the paradigm is starting to shift a little bit. I think that it's not always the woman that has to do that.
That's
And it
true.
should not be that way anyway. But I think that paradigm is starting to shift a little bit, where I'm seeing a lot more people in my generation who are both the husband and the wife are taking parental leave. So
Yep.
that's a shared thing that the wife takes 3 months and then the husband takes 3 months, and between the two of them, that gets them, the baby is then, or the child is then 6 months old at that point and more
Yep.
able to rely on other caretakers. So there's that. I think it's starting to change, but we're not quite there yet.
Yeah, no, I agree with you. I have, in the last year or two, I've read about or met people, men, that's their job. They stay home and take care of the kids because the wife's got a job that can support the family. And I think that's really great because it takes two, as they say. So it would be good if two also jumped in to help. I
Yeah.
like it. And do you know what else though? I've got to look this up. I've got to talk to Blue Cross Blue Shield. People have been telling me how much improvement in what's the word when you're working really hard, your production, the production rates of people working at home are hitting the ceiling. They're just higher than when they're in the office, which is, I think, an amazing revelation to people that when they work at home, their production rate is much higher than when they're in the office. So that's a good thing.
Yeah. Well, and there's trade-offs to that, but yes, that's generally true. Production goes up. What you lose a little bit is collaboration.
Wow, that's true.
So it really depends on the industry, it depends on your business culture, if that is a worthwhile trade for you.
Right.
And not all businesses will make that decision. So.
I was always, we had a big discussion about that in state government about what jobs can work at home. And the managers, including myself, always wanted a job that you could count the widgets or count the papers or count the number of calls they made. Because how do you judge what they are doing at home when they're not in an office environment? But apparently, the statistics that you don't necessarily need the widgets; they're just working, and over time, they prove that they're working because of the response from the customers, or sales go up, or whatever. So it's a good thing all around.
Yeah. Well, we are at the end of our time for today, but thank you everyone for joining us.
Yep, and stay tuned because we'll continue to bring you what's brewing in Vermont. Get those coffee cups out, folks. See ya.